have more now in the fight against the pandemic. President Biden announced plans to purchase an additional 100 million doses of the Johnson & Johnson vaccine yesterday during a meeting with pharmaceutical executives.
And today, I'm directing Jeff and my HHS team to produce another 100 million doses and purchase another 100 million doses of the Johnson & Johnson vaccine. I'm doing this because in this wartime efforts, we need maximum flexibility. There's always a chance that we'll encounter unexpected challenges, or there'll be a new need for a vaccine effort, a vaccination effort. A lot can happen, a lot can change, and we need to be prepared. And of course, we need to match the miracle of science and the skill of manufacturing with the massive logistical undertaking of vaccinating over 300 million Americans.
Joining us now, White House Senior Advisor for COVID Response, Andy Slavitt. Andy, thank you very much for being on. I want to ask about the administering of these vaccines, not just across this country, but around the world. From the data that you all are looking at, is the vaccine going to be able to keep up with the strains that keep popping up? And is the speed of administering it an issue?
Well, good morning. It's a great question. We absolutely, let me start here in the U.S. where, we inherited a situation where we were well behind and where we had only vaccinated 8% of seniors. And today we're just past the 50th day of the president's term, and we've gotten past 60% of seniors. And we've done that with a lot of help from people across the country. And so I'm more and more optimistic that we will be able to protect the most vulnerable people over 75. But we're not even close to there yet. We've got 25% of adults in the U.S. vaccinated, and we need to do more and step on the gas over the next few weeks and months to get that done. And you're going to hear that from the president tonight. It's a great question about the rest of the world because where this virus circulates, the virus can return. Not only that, but as a nation, as a wealthy nation, we have a commitment to the rest of the world that we have to make sure we're helping the less wealthy nations. So COVAX is the primary way we've been doing that. And as we enter in this historic partnership with Merck and Johnson & Johnson, we're going to get massively more production, and that's going to help the U.S. and the rest of the world.
Andy, good morning. It's Willie Geist. Tomorrow, Joe Biden, the president of the United States, will sign this $1.9 trillion package into law. Big numbers we're talking about here, but if you can bring it down to street level, what does it mean explicitly for people in this country in the fight against coronavirus? What will happen next week? What will happen 2 weeks from now, a month from now in this country? How does all this money change things?
Thanks for the question, Willie. There's a couple of priorities that we need to take stock of in getting the country vaccinated. Certainly more vaccines, which we spent a lot of time on, but the states need more vaccinators. They need more vaccination sites. And then we need to bring vaccines to people. We've been playing a massive scale game, as you know. We've been building large-scale vaccination centers, which has helped get lots and lots of people vaccinated. But increasingly, we're going to need to be reaching people who may not have the ability to get to these kinds of places, that may have questions about their vaccines. And so states are going to need to set up things like mobile vans, more community accessible vaccines. So people who are in hard-hit communities we're going to need to have the resources, the infrastructure, the capabilities to bring those things to them. And so this is really important for that. I'd also...
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to you at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.